Morning, everyone. Today is Thursday, November 16th. Thank you so much for joining in to our weekly HCR webinars. There is a lot to discuss today, and the fact that next week is Thanksgiving and we won't have a webinar next week, I wanted to at least bring you up to date as much as I can, for the hiatus, if you will. So just with a show of hands, your electronic hands on the control panel, if you can just put those up if you can hear me and see my screen all right. Awesome, great, perfect. Okay, for those of you that are new to the program, my name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. I oversee the group health markets as well as the individual markets in Pennsylvania. And you can ask questions in two different ways. You can raise your hand and I'll unmute you at the end of the webinar, or you can type them into the question box and I'll answer those at the end of the webinar. So again, thanks for joining in. Not a whole lot going on in Washington other than the usual talk of Russia and everything else. But what may be important to all of you that are on the call this morning is that the House is to vote today on the tax, the new tax law. Senate is reported to want to vote after Thanksgiving on their bill. And what we're being told, or what I'm listening to on the news, is that the House will vote today, the Senate will vote hopefully after Thanksgiving. Once that's done, the bills will come together through committee, and then it will, of course, come out the end, hopefully as one consolidated bill. At that point, they feel that they can add the individual tax penalty repeal. This is not a sure thing, but this is what all the chatter has been about. So, that could be good or bad. Obviously, a strong tax penalty was something that was needed in the individual market from the beginning, but we didn't have that. If you recall, 2014, the penalty started out as $95 per person, or 1% of your taxable income. It's now $695 per person, $347.50 for children, or 2.5% of your income, whichever is greater. So if it's repealed, great. If it's not, doesn't matter. But what I say is, ask you, what will this mean for the marketplace? And as we all are, we're all looking for those pockets of opportunity. So where is your opportunity if the tax penalty is or isn't repealed? And what I say is it's just going to add more confusion. If any of you have been in the individual market, and I know you have, typically the sales are relatively modest until after Thanksgiving. Well, with all this talk and the news outlets talking about tax reform and the individual tax penalty, I think more people are going to wait. More people are going to be a little bit more indecisive, which may or may not open up opportunities on the ACA market, on or off marketplace for you. But what I say is it's probably going to open up more opportunities to talk about the Christian Health Share Ministry plans, or the short-term medical plans, or GAP plans, or even limited medical plans outside of the Christian Health Share Ministry. So I think your opportunity, it comes from just the continued confusion in the market, and the fact that people will wait and reach out to you probably at the 11th hour, and you will be able to sell them a product. So I think that's the good thing. So let's jump down to the next bullet point. Aetna AFA, starting this year, I did mention this, they will be handling the 1095Bs. So they're going to prepare them and send them out to the groups. I think that's an awesome offering from Aetna. So for those of you that are writing Aetna AFA, it goes down to 5 lives. It is a level-funded, self-funded program, but this kind of takes the administrative burden off of the employer. So it's kind of a win-win, and they have some great rates right now. So anyway, that's my tip for the day, or Aetna AFA tip for the day. Cap Blue Cross Renewal Auto-Mapping. Just to remind you that 10 days, this is specifically to group, 10 days prior to the group's renewal, if there's no decision, the group will renew as is with billing sent and ID card sent for their incumbent plan. You can still make changes 5 business days prior to the renewal date. They'll allow that, but you know, the cards and the billing is going to be messed up because of the 10-day prior requirement. So what that means as far as the 5 business day cutoff is, that means next Wednesday, the 22nd, our cutoff is going to be implemented for the renewals for 12/1. So just be mindful of that because of the holidays, it's moving up. And if you have renewals, please try to get those in. I know that's not always on your shoulders, that it's hard to get appointments with the groups sometimes or get their decisions, but please try as much as you can. It's only going to make fourth quarter a little bit more stressful for everyone when they get calls about, or when you get calls about the ID and the billings being wrong. So just be mindful of that. Try to stick to the cutoff. 1/1/18 group health quoting, we are still working on the alternates. We're getting those out. The carriers were a bit slow to release the rates. All of you should have your 1/1/8 renewals, and for any of those alternates that you've requested, we are working diligently on those, getting those out. They will not include Aetna fully insured programs because they are not releasing those until 12/1 for 1/1 effective dates. Because as you know, and as we've discussed before, Aetna is really focusing all of their energy and resources on the AFA market, the self-funded market, as opposed to the fully insured. So what they're offering on the fully insured market is not very attractive in product design or pricing, and the release could be just because they're not promoting those products and want to promote the AFA. So that is not our holdup. I want everyone to be aware of that. You know, that is Aetna's delay in releasing those rates. So for those of you that sat in on our Christian Health Share Ministry program a couple weeks ago, November 3rd actually, we are having a 201 webinar on the 30th, which is 2 weeks from today, from 2 o'clock till 4 o'clock. It is going to be an intense 2-hour training. You must have sat in on the 101 webinar and requested appointment. If you haven't done that yet, I urge you to do that as quickly as possible. And I'm going to show you on our website where you can go. Our website is urlinsgroup.com. You can go to our website. This little YouTube icon is where we house all of our webinars, whether it's from our life division, annuity, senior, etc. Here's one on Legal Shield that Employee Benefits Department did. All of my weekly webinars are housed here. This is the affordable alternative to the ACA for individuals and families. So this is about the ProLife health plan, and it lasts about an hour. If you have any interest in selling this product, and it is commissionable, it is very comprehensive. If you have interest, please listen to this webinar and shoot me an email or give me a call and request contracting ASAP so we can get you up and running. The 201 webinar that is held on the 30th is going to be by invitation only. So if I don't have you as requesting contracting, then you won't get the invitation. So please be mindful of that. And I want to jump down here real quick. How the heck, well, there goes my language. How the heck can I quote individual medical? So I wanted to jump back over here to our website. And excuse me for a second, let's get over here. If you go into the Aries box, this is our brokerage services, or you can go through Gemini, or if you're a Gemini partner, go to health plan options and quoting tools. Quoting tools, you're going to have your individual subsidy calculator. You have the Health Choice Select quoting tool. This is one of the limited medical programs included in the package deal of the ProLife health plan, the Christian Health Share Ministry. So that's one of the limited medical plans. This is the other, the Health Saver Plus. This is our health marketplace quoting portal. This is for on marketplace only. It's for quoting only. Do not hit the enroll button, but this is going to give you the pricing and the estimated subsidy by going in and quoting that. IHC short-term medical, this is one of our short-term medical options. And then, of course, the National General short-term medical quoting portal. National General, as we discussed, and here's another opportunity for you. As of 1/1, effective dates, you can sell 4 consecutive 89-day policies. So when one expires, the other automatically regenerates. It is a separate policy, separate deductible accumulator, pre-ex accumulator. But again, it is an alternate to the ACA. The short-term medicals do still have, they're not qualified health plans, so they would still be subject to the individual tax penalty, which is still the law if you purchase one of these, but they certainly would be more affordable. And then, of course, the ProLife health plans in combination with the limited medical plans, because it is affiliated with a Christian health share ministry, and they're going to be members of a Christian health share ministry, there is no individual tax penalty. So I hope that helps. Let me get back here. Excuse me. So just bumping up here, I want to just remind you, it's been a while since I've talked about our group offerings, but if you are doing group health business and you're interested in talking to me after fourth quarter, I would love the opportunity to sit down and let you know what we offer. For those of you that don't know, we offer Federal Cobra, summary plan documents, the wrap documents, and benefit notices, which are specific to the group size, the group's name, and it keeps these groups compliant. So these are all complimentary benefits that we offer when you write your group business through us. So again, if you have any interest in learning more, please let me know. So that brings us up to our open forum. There is information about the commissions. Just, you know, we've gone over that. If you want additional information, reach out to me. But we'll open it up for questions now. Just a reminder, there is no webinar next week due to Thanksgiving. I did put a little picture of a turkey up here. I was looking for one that was kind of animated and very cute, and then I saw this one where the turkey is fully loaded and ready to do battle. I thought that was probably more appropriate. So hopefully you enjoy that. All right, so let's see what sort of questions we have. Seems we have a lot. Dave says that he understands that he doesn't need to take the marketplace training to receive the Capital Blue Cross commissions. Is that correct? That's what they're saying, Dave, but I don't agree with that. I think that if you know, it's always been up until this year when there's been some a bit of a gray area, that if you want renewals on the marketplace, then you have to be certified. Because think about it, not many people, and in all of these years that we've had these programs since 2014, not many people have retained the same coverage. The carriers are changing coverages all the time. So essentially you're going from a 17 plan to an 18 plan. It is going to be considered a renewal. However, it's still a new FFM policy. So I would absolutely encourage you to do your FFM certification, Dave, if you haven't, just to protect those renewals. Highmark, for instance, requires that you do your FFM certification whether you're selling on or off marketplace. So it's not a bad idea. It doesn't take forever. So please do it. And I will definitely send you information on the Christian Health Share Ministry plan, Dave. And let's see. Tracy says, if you are selling through the FFM, you can still see the CSRs in the silver plans. Are we saying that the carriers are going to honor that with Trump's executive order, or should we just sell the gold level plans? Not sure what you're talking about in the cost share reductions, Tracy, because the cost share reductions are not going to be paid, but that doesn't mean they're going away. They're just not being funded by the government to the insurance carriers. So the silver cost share reduction options, the 3 levels, are still out there and still available. So maybe you need to chat with me offline, and maybe I'm just misunderstanding the questions. But the executive order essentially saying that they're not paying the cost share reduction reimbursements to the carriers, that's what was dissolved, not the actual cost share reduction itself. Dave says, I know I'd have to enroll with CMS prior to 12/15 to get the CBC commissions on new enrollees, but do I have to be enrolled before helping a client? You have to be, yeah, Dave, yes, you do. Let's just face it, you do. Get your certification, do it now before you sell anything. Some carriers say that when they go to pay commissions for 1/1, they'll look then, if you're not certified, then you don't get commissions. So there is a bit of leeway, but don't hesitate, Dave. I mean, you fight hard enough for these commissions. Why, not take an hour out of your day and do the certification just to be safe? So my word to you, Dave, is do it. Kim says, Aetna fully insured is available to quote online, just no member level breakdown on paper rates. Correct. We can rate them through the Aetna portal, but it's kind of a waste of our energy because it's a different system, and they're really not that competitive as compared to some of the other programs. Dave says, do the Christian healthcare exempt from the individual mandate? Yes, Dave. One of the exemptions to that individual tax penalty is if they are a member of a Christian health share ministry plan. So the programs with the membership, which is $45 per person per month, capped at 3 people per family, that's the membership to the Christian health share ministry. And you don't sell that, you educate them, you give them the link, they go and sign up themselves. What you do sell them is what is sold in combination with a Christian health share ministry membership, and that's the limited medical programs, the accident, the gap, the disability, and the critical illness. So that's what you're selling, and it's a nice compensation as well. Jim says, Deb, would you present the commission for the individual market again? Absolutely. Let's go back here. And here are the commissions. So UPMC is paying $10 per member per month, $5 per member per month renewal. The expansion counties do include URL. Commissions paid on the select and partner networks only, and Tower Health Network, which is Tower Health is in the Reading, Berks area, Berks County. So that's what UPMC is paying on the individual. IBX is paying basically what they paid 2 years ago. If you want me to email you that information, I can. And let me just write that down. And Capital is $8 per member per month on the new business, $12 on renewal. Central PA, Highmark, well, first let's go here. 3% renewals only on Geisinger, and of course Aetna has no plans on or off FFM. So Highmark for Central PA, the EPOs, new business is $10 per member per month total. That's $8 to the agent, $2 to URL. Renewal is $12, $960 to agent, $240 to URL. New business in the PPO segment is $0, but they are paying renewal, $5 total, and that's 4 and 1. Western PA is here as well, and NEPA. So hopefully that helps. I can email you that information. Let's continue with the questions. Peggy says, please send commission info for Christian Health Share Ministry. I will do that. And Tim, I just did the commission slides. I can send those to you. I'm sorry, I have to write some things down here, record. All right. All right, I think that is it. I apologize, I was trying to read. Some of the responses are just giving me email addresses, etc. So that appears to be all of the questions for today. As always, I appreciate you joining in And all of you, I wish you a wonderful balance of the week, a wonderful weekend. And since we won't be talking next Thursday, hopefully you'll be spending some wonderful and valued time with your family and loved ones. And I hope you all enjoy your Thanksgiving holiday celebration. Bye-bye.